This video is solely for the purpose of providing information to users of ModelMed International training models in the correct use and care of those products. They do not intend to show correct clinical techniques and must not be used in any way as a clinical training guide. How to use Sophie and Sophie's mum to simulate a breech birth. Before using Sophie's mum, make sure she is thoroughly lubricated with a water-based surgical lubricant throughout the entire birth canal. KY jelly works very well. Please note that ultrasound gel does not work at all and should not be used. 1 or 2 squirts of water can help make the inside even more slippery. Now cover Sophie with a generous quantity of lubricant from head to toe on both the back and the front. Fold Sophie over and insert her into Sophie's mum's pelvis. Your hand will be on the back of her neck, pushing on her shoulders to move her into the birth canal. You can push on Sophie's head to continue her movement through the birth canal. Always ensure that her arms are in front of her body and not behind her head, as this can put undue stress on her skin and skeleton. Try to get the head through the pelvic brim in the transverse position before swinging the head to the midline. Now push on her head to continue her progress. In this special cutaway model, you can see clearly when you push on the shoulders to get Sophie into the birth canal. Next, we push on the head in the transverse position until past the pelvic brim. Then we can swing it to the midline and continue through. In this scene, you can see a typical scenario with Sophie and her mum. There are 2 people using the model. One is simulating the birth, while the clinician at the other end can practice the various manoeuvres and techniques used in a breech birth.